OBGYN physician with over 30 years of women's healthcare experience, I've noticed some of my patients think pain after their menstrual cycle is normal. Actually, the symptoms could be a sign of something more important. I'm Dr. Stan Yeatts. If you've ever felt those mysterious pains after your period ends and wondered what's really going on, you're not alone. More than 40% of women experiencing this kind of pain have an undiagnosed condition. It's normal to have menstrual cramps before or during your period, but significant pain is different. I've had many patients who assume that pain after their menstrual cycle is just the way I am. The human body is designed to detect pain. Of course, we all experience pain for different reasons. If the pain is new but spontaneously goes away, it may not be important. If the pain is mild, the same thing is true. However, if it's severe, persistent, or accompanied by other symptoms, it's reasonable to ask questions and seek medical evaluation. Pregnancy can begin with cramps. The implantation timeline may be of interest. When fertilization occurs, the embryo typically implants in the uterus 6 to 10 days after ovulation. This process can cause mild cramping and light spotting, symptoms that many women mistake for an unusual period pain. Other reasons for post-period pain with pregnancy include threatened miscarriage or even ectopic pregnancy. Pain in early pregnancy is important to acknowledge. Medical evaluation is crucial to know more. The assessment is not always complete with a single visit because ultrasound could be unhelpful in early pregnancy. Lab tests often include HCG levels and could require repeat testing for better understanding of the situation. In my practice, here are common reasons for post-period pain without pregnancy. Endometriosis, it can affect about 45% of women. Adenomyosis, around 30%. Uterine fibroids, 20%. Hormonal irregularities, 30%. Ovarian cysts, 15%. Pelvic inflammatory disease, 5%. Some women have more than one cause of their pain. Early pregnancy can also cause pain. A pregnancy test helps your women's healthcare provider to know how to help. When conception occurs, your body starts producing HCG, human chorionic gonadotropin, triggering possible cramps besides a positive pregnancy test. The fertility window includes the length of time an egg can live, which is 12 to 24 hours, and the length of time that the sperm can survive in the woman's reproductive organs up to 5 days. This creates roughly a 6-day window when pregnancy is possible. Understanding this timeline can help you understand your symptoms. Your reproductive health journey matters, and we're here to help. Here are some simple ways to ease pain while protecting a potential pregnancy. Gentle heat therapy, stretching or yoga, proper hydration, balanced nutrition, stress management techniques. Did you know that endometriosis affects approximately 10% of women of reproductive age, while adenomyosis affects roughly 6%? Both conditions can cause pelvic pain and abnormal bleeding. Endometriosis is a benign condition in endometrial glandular tissue that is implanted beyond the normal place inside the uterus. No one really knows how it gets there. The implants are often small and can look like a freckle on your skin. That's why pelvic ultrasound may appear normal, though endometriosis is actually present. Wherever the implants are located, they are stimulated by your estrogen, which causes some inflammation and the related pain. Adenomyosis is really like endometriosis. The glandular tissue is found deeper inside the muscle walls of the uterus. Adenomyosis is found in about 20% of the time when endometriosis is present. Both conditions have a wide range of symptoms from mild to miserable. Believe it or not, I've had many patients who had no problems such as pain or bleeding and were ultimately diagnosed with endometriosis or adenomyosis. These conditions are unpredictable. They can be found in other family members. If you experience recurring abnormal bleeding or pain, please seek evaluation with an experienced women's health care provider. You owe it to yourself and your loved ones to get answers to regain quality of life. Please don't read about extreme situations and worst-case scenarios. I've had patients who were diagnosed with endometriosis that never had a problem getting pregnant. With proper diagnosis, conservative interventions and treatment can help. Some symptoms may be briefly unpleasant and spontaneously resolve. Recurring symptoms that you don't understand could be important. It's okay to seek medical advice for symptoms that alarm you. Here are some examples of reasons to seek medical attention. Unrelenting abdominal pain, heavy vaginal bleeding with a lot of blood clots, continuous vomiting, blood in the urine or bowel movements. Are you already pregnant? Make the most of your experience. Our Stork Advisor website and app can help you navigate your journey and thrive in your pregnancy journey. We also have content for women after the baby is here to encourage breastfeeding, mental wellness, and parenting. Stay empowered through education. Knowing if you're pregnant makes a difference in understanding the symptoms and causes of pain. And above all, never underestimate the value of seeking medical attention when things seem unclear. If you're experiencing post-period pain, consider checking a pregnancy test. The home tests are more accurate than ever. A positive test can be seen before you even miss a period. Just be aware that testing too early can give false negatives. More importantly, seek medical attention if you experience sudden, sharp, one-sided pain, heavy or abnormal bleeding, fever above 100.4 degrees Fahrenheit, or continuous vomiting. Your body's signals, such as pain, are worth noting, especially in the context of pregnancy. You never know, but what seems like a simple post-period pain could be the beginning of an amazing journey. I hope some of this information has been helpful to you. Remember, you're not alone in this journey. Schedule a consultation with your local women's health provider if you're having recurring pain beyond your period. We'd like to hear from you, so reach out to us in the comments section below or on our Stork Advisor website. Hit that subscribe button and notification bell to ensure that you'll never miss our women's health updates. I've learned a lot from my patients and their experiences through my 30-plus year career. I want to share this information with all women who may benefit. This is Dr. Stan. Thank you for joining me today.